Welcome to this session on how higher patient employee and physician satisfaction leads to better outcomes of care. In this session, we'll explore a powerful but often underappreciated truth in the healthcare: the direct connection between satisfaction and outcomes. We'll dive into how higher satisfaction, not just among patients, but also among employees and physicians, translates into better quality of care. Over the past 25 years, hospitals worldwide have started recognizing something powerful. Patients are excellent judges of care quality. In the United States, patient satisfaction surveys are now routine and often tied directly to governmental reimbursement. But these surveys don't just ask if the food was good. Research shows strong links between satisfaction and clinical outcomes. Globally, countries are focusing on responsiveness, how people are treated when they seek care, and in many systems, the emergency department is the front door to the hospital. Making patient satisfaction in the department is critical to reputation, revenue, and results. Worldwide, part of hospital payment is linked to patient satisfaction scores. But beyond the finances, the departmental experience affects clinical outcome, admissions, and the hospital's reputation. Long waits and poor communication leads to patient stress and dissatisfaction, even if care is technically excellent. On the flip side, patients are willing to wait if they're kept informed. In the 1980s, focus expanded to employee satisfaction, especially as hospitals struggled to recruit and retrain top clinicians. The result? A major insight: without satisfied caregivers, it is highly unlikely you will find satisfied patients. In fact, studies show strong positive correlation between patient satisfaction, employee and physician satisfaction, clinical quality, operational performance, and financial outcomes. Patient satisfaction data includes quantitative ratings, qualitative comments. To drive change, leaders must ensure data sample sizes are reliable for analysis. Focus on trends, not single data points. Target high-impact survey questions like communication, empathy, and pain control. Benchmark against similar institutions. Use certified third-party survey tools for valid comparisons. These steps allow leaders to identify weakness, design solutions, and monitor impact over time. Based on 1.5 million US emergency department surveys, patients consistently rank the following as most important: how well they're kept informed about delays, pain control, are they being treated with care and empathy, overall quality of care, and communication from nurses about treatment. These aren't about fancy equipment, they're about human connection. So, what does the research say? Studies confirmed that they found a strong link between overall satisfaction and clinical performance, linked higher satisfaction to lower mortality in heart attack patients, tied satisfaction to lower infection rates. Satisfaction isn't fluff, it reflects actual safety and quality of care. Research shows doctors and patients rate hospitals similarly. Employee satisfaction predicts patient satisfaction. Physician and nurse relationships affect patient loyalty. Happy teams deliver better outcomes. In the previous research discussed, it shows a direct correlation between staff satisfaction and patient experience. In short, happy teams equals healthier patients. Dr. John, Chair of Emergency Medicine at Oregon Health and Science University, embedded service excellence into physicians' training. New residents get a welcome letter emphasizing service. They are trained in communication from day one. Follow one patient from arrival to discharge to build empathy. These initiatives included follow-up calls, triage scripting, feedback comment cards. What did they show? These improvements boosted satisfaction and quality. It pays to satisfy patients. One Medicare study found hospitals in the 90th percentile of satisfaction gained 1,400 more patients per year. Hospitals in the 10th percentile lost 17% of volume. More satisfaction equals more patient equals more revenue. Many patients rate department's care as good. The goal? Convert those to very good. Quick wins include keeping patients informed, reducing wait and anxiety, addressing root causes like communication gaps and staff attitudes. In one study, with a new triage model, direct rooming, and better communication, satisfaction jumped from single-digit national percentile to the 99th. Scripting isn't about robotic lines. It's about delivering key messages clearly and compassionately. Examples: let me give you some privacy while closing a curtain. Doctors thinking out loud during assessment. These subtle cues enhance understanding, reduce stress, and build trust. Satisfaction isn't difficult. It hinges on direct-to-bed protocols, greeting and triage experience, reduced wait times, efficient movement through the system, and friendly informed communication from administrators. Case study: implemented administrator on duty to escort patient to care areas. Result: wait times dropped, left without being seen rate cut in half. 400,000 in annual revenue recovered. Satisfaction skyrocketed despite 13% volume increase. Let's take the emergency department as an example. Emergency departments are using analytics to separate low acuity cases, reduce length of stay, and improve flow for all patients. Triage models include provider at triage strategies, team triage with greeters and mid-levels, direct-to-bedroom protocols. Each one improves satisfaction and clinical outcomes. Overcrowding isn't just a single department's problem, it's a hospital problem. Using solutions such as real-time bed tracking, smoothing elective surgical schedules, reducing boarding, coordinating inpatient flow with inpatient units, using queuing theory and simulation models, improving system throughput, improves both care and satisfaction. Around the world, patient satisfaction is no longer optional, it's essential. Key takeaways: satisfaction boosts quality, safety, loyalty, and finances. Continuous measurements drives real change. Addressing satisfaction means involving everyone: patients, employees, and physicians. Cultural change and system change must go hand in hand. Most importantly, patient satisfaction is not just a metric, it's a mission. Thank you for joining us in this session on how higher patient, employee, and physician satisfaction leads to better outcomes of care.